This is really something I'd like your feedback on, because I've been looking into the running costs of the NHS. It costs more to run the NHS than it does to run some small countries. So clearly it's a costly enterprise, and I think it could have simplistic reforms without it being too impacting on having to change many things. I did a list for Twitter to see how it would go, because again, as I say, I want your feedback on this. So I've begun with, I don't think some of you might like this, because obviously it impacts on all of us, but here's some easy fixes that I see it to the NHS, which is obviously, it's not short of funding. The funding it gets is spent in the wrong areas. Like during lockdown, it got 3.8 billion extra, 3.8 billion, and it spent 38% of that on management jobs. So here we go, here's the easy fixes. It's to stop the bad spending habits. 1, dissolve DEI managers, they're pointless. Diversity, equity and inclusion. We should, above all else in the healthcare industry, be employers of people on their merit. Make it free to access at GP level, but charge £15 for a missed appointment and a sliding scale for abusers. Say £20 if you miss more than one. Talking to some GP surgeries, some are habitual no-shows, and one person has actually no-showed 15 times in 1 year. Employ British staff first, not cheaper imports who can't communicate properly. Stop employing interpreters. If they need it, the patient funds it themselves, just like they do in other European countries like Spain and Austria. Stop printing everything in multiple languages. It's not our problem. Again, it should be down to the patient's responsibility to understand what's being said to them. Stop sending people to A&E on the slightest thing. Insist that family members have a basic first aid training. One family member in a household, especially if there's kids, you've got a basic first aid training. That would make such a difference. Stop the ridiculous long-term sick for mental health workers. Now, someone who works in mental health told me that some of the senior consultants only have 2 or 3 cases in a week, and some of them go off sick for 6 months at a time and just come back to work, do a couple of weeks and then go off again before it goes to a reduced payment level. There's a lot of waste there. Stop insisting on PPE you know that doesn't work, like perpetual mask wearing in hospitals. It's costly and pointless. Masks are worn as a shield to stop splatter. Now you can check this out with surgeon Ian McDermott, who's he's basically a knee surgeon, and they use them to stop splatter from the patient as they cut in, or from the surgeon if he sneezes. And obviously they're disposed of correctly in a bio-waste bin. These things are just left all over the place that the people have to wear, and the perpetual worse of a dirty mask can cause bacterial lung infections. Stop paying obscene fees for menial repair work. Example, the NHS backlog on repair bills has soared in 2024 to £14 billion. 14 billion. Stop NHS tourism completely. It costs between 100 to 300 million pounds per annum, and those were the last figures in 2019, but hard to get the figures after lockdown. If you actually stop the boats, then the healthcare that this creates would also stop. And seeing as we're talking about healthcare, I'm going to cover an article in Sally Beck's Substack. She won't mind me reading it out. The controversial drug midazolam is on trial next month as a senior coroner confirms a full inquest into the alleged unlawful killing of a man in his 70s. The man's son claims his father was admitted to hospital but put on the end-of-life drug to euthanise rather than to treat him, and says that without it he could have made a full recovery. He was given enough midazolam to kill an elephant, a source claims. According to the family friend, the pensioner was admitted to hospital with gout. He also suffered with dementia. Gout is a very painful type of arthritis typically treated with anti-inflammatory drugs like steroids. Instead, the hospital put the man on NICE guideline NG163 pathway used to relieve end-of-life symptoms. The family say the protocol was used to end his life and was totally unnecessary. Now, when you're reading things like this about the NHS, especially at my age, it's a bit worrying because some people claim, and there've been NHS workers, that the Liverpool pathway has never really gone away, which is a bit spine-chilling, really. Nobody wants to have a painful death, but unfortunately, these drugs seem to be given away tag-like, which is why Nigel Farage at Reform have pledged to investigate Matt Hancock regarding the way things went during lockdown, because not only that, the elderly were withdrawn from their families. They couldn't see these people they normally depended on to check things out at the care home. I helped an elderly man. He had a son in care who was very badly disabled mentally and physically, and he couldn't walk. He eventually stopped walking. He could walk, but he suddenly was always bedridden. And he sent me a photograph to challenge this. And when they took his socks off, I'm going to show you my finger, his toenail was like that, curled right round under his foot, all of them. So instead of actually cutting the toenails, if there was a care home, they just put socks on him so that his visiting relatives couldn't see, and he kept making the noise that he was in pain when his dad tried to get him up. So I wrote to the care home, and I was very polite, but sent the photograph, and I asked them to explain, because I'd read the blog on the website where a care home that professed to be like this was actually leaving one of the long-standing patients in this condition. Immediately she responded because she didn't want any publicity, and the lad was attended to. The nails were softened. They had to be drilled off, like with a little like circular saw thing. They were that bad. I mean, this is like 21st century Britain I'm talking about. I'm not talking about, a third world country here or Dickensian London. And it just worries me to see the way the NHS is going, because literally I have people messaging me saying they're terrified if ever they have to go into hospital for anything. I'd like some of your feedback to see if, I've not really had much dealings with the NHS apart from a car accident, and I've got to say the paramedics were fantastic. They really made me feel reassured. I'm just wondering what your feedback is, because there's plenty of you. There's a good nucleus of information here when I read it, because you'll all have had something at some point. Good stories and bad. I'm not looking just for criticism. I want to discuss the NHS because I want to discuss it with Reform. Don't forget to subscribe, click the bell thing and what have you. I'm going for a brew.